Tips for staying healthy. I put this cartoon up. We like to think that we can just do one thing to help our health. The cartoon says, don't tell me to improve my diet. I ate a carrot once and nothing happened. So tonight we'll go over some preventive health screening guidelines, stress management and its impact on your health, and then obviously some healthy choices around food, fitness, family, friends, finance, and faith. So there's an organization called the U.S. Preventive Services Task Force, and their job is to think about preventive health and what recommendations should be put out into America. So these are a summary of some of those recommendations. All adults should get influenza vaccination. Now, these are recommendations for national health. Of course, everything that's a recommendation, you as a person or as a patient need to interpret what's good for you. So obviously if you're allergic to the flu shot, you're not going to take the flu shot. But as a general recommendation, everyone should get vaccinated. Next is tetanus and diphtheria, or TD. All adults should have a booster every 10 years, and at least once you should have something that includes the P part, the pertussis, which is whooping cough. And there's been a resurgence, a reoccurrence of whooping cough that had gone away for a while. It's just a very dry cough that won't go away for about a month. So if you're not sure, you should check with your doctor, and if you haven't done it in 10 years, it's probably a good idea to get a booster. Varicella is chickenpox. Anyone born after 1980 needs to have that vaccination. Everyone here is born before that, and so you probably had chickenpox as a child. If your doctor were to check a blood test for a titer, it may or may not show positive, but you're likely to have been immune and you probably don't need the vaccination. Herpes zoster is shingles. Has everyone here heard of shingles? Yes. So it's unfortunately relatively common because it's the same virus as chickenpox that lays dormant in your spinal cord. And at some point later in life, it can come out as a painful blister rash along a nerve root. Fortunately, in most cases, it comes and goes and is a limited illness, but in some rare cases, it lingers longer and can be a pain condition. So getting a vaccination over age 60 can be helpful in preventing getting the disease or having it be more serious. And then lastly on this slide is a recommendation for pneumococcus vaccination. Strep pneumococcus is one of the most common causes of pneumonia, the most common types of bacteria that cause pneumonia. So all adults over 65 are recommended to get one shot. And if you're under 65 with risk factors for pneumonia, such as asthma, COPD, heavy smoking history, it's probably a good idea to talk to your doctor about whether you should get that vaccination as well. Yes.
I had the shingles shot, and I still got shingles.
Yes. So that happens. You can get a vaccination and still get the disease. Because what a vaccination is a small introduction either of the live or the killed virus to your body, and then your immune system needs to react and be familiar with it so that it can attack it or prevent you from getting the disease. But sometimes what happens is the antibody response is not that strong. So, but hopefully your course of illness was less than had you not received the vaccination, that the reaction might have been less.
How often should you have these? I know you got Tdap just one time, but what about the others?
Okay, so the question is how often should you have them? Well, influenza every year, tetanus every 10 years, and the others just once.
Oh.
Yes.
Oh, diphtheria only once?
Yes. This is kind of geared toward younger folks. HPV vaccination is recommended for women 11 to 26, men 11 to 21, because it's largely a sexually transmitted infection that can predispose women to cervical cancer. There are 4 of, about 60 different types of human papillomavirus isolated that have been very much linked to cervical cancer. So it's a relatively new vaccination given to young people. I would say it shouldn't be limited to younger people. People of older age are having new partners and switching partners, so it's something to talk to your doctor about if you kind of know you're going to be switching sexual partners or have multiple partners. Measles, mumps, and rubella is recommended for adults born after 1957 who have not had the vaccination or are not sure whether they have the disease. It's especially important in women before pregnancy. Meningococcal disease is really a vaccination geared towards young adults, adolescents, or people in dormitories, HIV, or people with no spleen. Hepatitis A, if you're going to travel to very rural areas and you talk to your doctor about it, they'll probably recommend that you get a hepatitis A vaccination series. Men who have sex with men, drug use, and chronic liver disease are also reasons to get a hepatitis A vaccination. And then hepatitis B vaccination, adults with increased risk of transmission, morbidity, or exposure, such as healthcare workers, or if you're living with someone with known hepatitis B disease, that would be very important. Nowadays, all the kids are getting it automatically. They're getting hepatitis A and B vaccination because chronic liver disease is quite a serious illness, and prevention with vaccination can be very helpful. Other things the U.S. Preventive Services Task Force recommend are periodic screening for a variety of illnesses, which I'm sure you all get when you go to the doctor. So someone should be asking you about your alcohol intake and making sure that it's not something that's going to put you at health risk. Smoking. It's discovered more and more that any amount of smoking is bad for your health, and any amount that you cut down improves your health. Rather directly and rather immediately. Obesity, high blood pressure, high cholesterol, osteoporosis. Abdominal aortic aneurysm is also something that needs to be screened for. Yes?
What is hyperlipidemia?
Hyperlipidemia is high cholesterol. So lipid is a different word for cholesterol, and hyper is high. The next point, we're checking cholesterol or lipids. All men over 35 ought to have it checked, and even men younger than that who have known cardiovascular risk factors, such as an early family history of heart attack, if they're a smoker, if they're diabetic, if they're obese, or have high blood pressure.
How can you check for abdominal aortic aneurysm?
That's a good question. How do you check for abdominal aortic aneurysm? Usually it's an abdominal ultrasound. So men over 55 are recommended to have that at least once. For some reason, it's less common disease in women. So there's not really a standard recommendation in women of when to get a screening for abdominal aortic aneurysm, which is a widening of the aorta and makes someone prone to having it suddenly burst and be a sudden death situation. And so if that's found, someone can have surgery electively to stabilize that aorta so it's not prone to bursting. And women, periodic screening for breast cancer obviously is very important. The age at which to start screening and how frequent to screen is always up for discussion and is a bit debated among the various societies. So you can take your pick, but as a consumer, you would want to know your own health risk and family history and decide what you think is best for you. And then, of course, insurances and what they cover comes into play. Screening for cervical cancer is recommended probably up until age 75 or so. And then periodic screening for colon cancer. Everyone over 50 should have a colonoscopy at least once. It used to be said that you could just get fecal occult cards to check for blood in your stool, but I think really the standard of care now is to have a colonoscopy at least once and find out if you have growths in your colon. Colon cancer can take up to 10 years to grow sometimes, so it seems really a shame to never check and to find out, that you could have prevented a life-threatening colon cancer if you'd had a simple procedure to remove a cancerous polyp early on. Just put an extra slide about breast cancer, just because it is about 16% of all female cancers. In 2014, there were over 200,000 new cases of breast cancer in women and about 2,000 plus cases of breast cancer in men as well. And about 40,000 women died of it, about 430 men. 95% of cases diagnosed in women tend to be in women age 40 and older, but it's certainly a disease that can hit a very young woman. In fact, I have a personal experience of a friend's daughter who came to see me with just taking stitches out because she had traveled to China and just needed her stitches removed. And we did that and chatted about her experience. And then I asked, you know, do you have any other health issues? She didn't have health insurance at the time because she had finished going to school and was between thinking about school and jobs. And so without health insurance, she asked me, well, you know, I knew that I had a breast lump for many years now, and I'm just curious what you think about whether I should have it removed. And sure enough, on exam, there was a hard lump. And on investigation, it turned out to be cancer. Even though we found it relatively early, she had a very aggressive form and actually died several years after that. So even someone in their 20s needs to be cautious and follow up on growths as we do. Risk factors for breast cancer are increased age, being female, having a strong family history such as a mother or a sister, lack of childbearing, lack of breastfeeding, obesity, smoking, and a history of benign breast disease. So the most important health screening that we do really centers around heart disease, because obviously if your heart goes wrong, you're dead. So that's the most important thing to keep healthy, obviously. And as I said, any cigarette use is known to be bad. Blood pressure greater than 140/90 is a risk factor for heart disease consistently. And then high cholesterol, which depending on what your situation is, there are various guidelines about how tightly your cholesterol should be controlled. So just for general purposes, I put on here that high cholesterol is considered to be a total cholesterol more than 240. Yes?
I see the specification for LDL is more than 190.
Yes.
When I have my LDL checked, they put down a spec of 199.
Sure. So again, it's going to depend on you and your doctor and your risk factors. So for example, a diabetic, their doctor is going to want their LDL under 130 to be much more strict. And so if you're generally healthy, your doctor might be more lenient with your cholesterol level.
So that figure is a figure that's put down by the doctor that you want?
No, it's a measure. So you get a blood test and have a measurement of your cholesterol. But then once you know what your cholesterol level is, your doctor might decide with you, shall we just let you do what you're doing, or shall we make some steps and changes to improve your cholesterol value?
I understand that, but it said more than 190 there.
Right.
But when I look at mine, it says more than 199.
Okay.
Is that something that's different with different labs?
Oh, it could be a different screening guideline. As I said, many different societies have different markers of when they want to call it abnormal. So it's not really I would say it has less to do with your laboratory and more to do with who wrote that on the lab slip. I don't know if that makes any sense. We can talk more later. But as I said, you know, what your target cholesterol is going to be more dependent nowadays on your particular health situation. It didn't used to be that way. Doctors and cardiologists used to tell you your total cholesterol has to be under 240 and your LDL has to be such and such. But more and more we know that individual cholesterol levels have a different impact depending on your overall health.
Does a high HDL compensate for a high LDL?
Yes, so it's an independent risk factor. So if you have a very high HDL over 50, it's a protective factor. If your HDL or good cholesterol is very low, under 30, it's a risk factor for heart disease because the HDL, the high density lipoprotein, actually cleans the arteries for you. And so if you have a lot of that going on, it cleans away the bad cholesterol. It's a great question. Yes?
Where does the good come from?
Where does the good cholesterol come
Yes.
from? Well, all cholesterols are metabolized by the liver and processed through a variety of enzymes and mechanisms. And so, you know, part of it is genetic. A lot of us are just born making good cholesterol and could eat horrible diets until we died, and that's just how our bodies are going to process cholesterol. And other people, diet can change your cholesterol level by 25 to 40%. You know, I recall my mother had high cholesterol. I think it was something like 250, and she cut out one slice of cheese, which she had put in her sandwich her whole life, that she used to take to work every day, her ham and cheese sandwich, and she cut that out, and then her cholesterol dropped to 200. So, you know, everyone's different in what is affecting their cholesterol value. Someone else might eat cheese, drop it, and it make no difference. So it's very individual. Diabetes is an independent risk factor for heart disease, as is obesity. And so definition of obesity has to do with a calculated thing called body mass index, which is a little tricky. You know, your doctor would have to calculate it. It's your weight in pounds divided by your height in inches squared times 703. But you know, there are target numbers that your doctor is aware of, what your ideal body weight is, what the range is, and what would be called obesity versus being a bit overweight, or that you just need to lose a little bit of weight. And the reason that that number exists is because the studies show that people in the range of obesity definitely have higher risk for different outcomes such as heart attack and stroke, diabetes, etc. So high blood pressure. You know, if any of you have high blood pressure in the audience, you know that your doctors get quite excited about the number that is seen on the day you're in for the visit. And the reason is it makes a big difference. So for every 5 points you reduce your blood pressure, you change your heart disease risk by double. So if you can reduce your blood pressure by 10 points, you're going to reduce your heart attack risk by 20% over time. It's very direct. And so your goal blood pressure, especially by your cardiologist, is he's going to want your blood pressure in very, very tight control, under 130/80 in general. And then I just put in the last statement that now we're also finding that too low blood pressure is also not good. And so in people over 75, I think maybe because as you get older, your arteries harden a little bit, and so the accuracy of measuring your blood pressure may not perfectly measure what your internal blood pressure really is, and so we might get a little bit more lenient with that number as you get older. It might not control it quite as tightly. So this is just a reminder that know your cholesterol value. LDL stands for lousy darn lipos, which is actually low density lipoproteins, and HDL stands for hunky-dory lipos, or good cholesterol, if you can't remember. Screening for diabetes, definitely anyone with high blood pressure should ask for a screening for diabetes, because the two together really confer quite a serious risk for heart attack. Women over 65 should be screened for osteoporosis, and anyone else who has other risk factors that might create a fracture risk.
What would be considered diabetic, what's the term, pre-diabetic?
That's a good question. What is considered pre-diabetic? So there's a blood test called hemoglobin A1C. And I believe the cutoff value for diabetic is 5.8 in the labs that we use at UCLA. And so it's something like don't quote me, it's something like 4.7 up to 5.7 is pre-diabetic, and below that is, you know, considered normal. I think I'm saying that wrong. I think the lower value is a little bit higher, but it's just a little range below fully diabetic range, because the hemoglobin A1C is a measure of sugar in your blood system, not just of that momentary sugar, but kind of what your blood cells have seen for several months as a sugar level. Oops. Okay, other preventive health screening guidelines center around infectious disease. So HIV testing is recommended if you're at increased risk, or pregnant women. Hepatitis C if you're at increased risk, such as from a transfusion or a blood exposure. Chlamydia and gonorrhea infection for sexually active women at increased risk, or someone with new or multiple partners or inconsistent condom use. Of course, you want to check your vision. check hearing, prevent burn injuries by making sure your water temperature in your home is not overly high, have working smoke detectors, and then address urinary incontinence. Wear seat belts and try to prevent falls. 5 to 10% of falls result in fractures, which is actually kind of low. You know, if you think about it, I think we're all afraid that if we fall, we're going to break something, but really about 1 in 10 times of falling, you actually break something, but certainly you want to prevent falling. Okay, so we'll talk a little bit about stress management. You know, everyone has stress, obviously, and what we're trying to prevent in a health discussion is a life-threatening event. And when I talk about stress in a life-threatening event, you know, there are chronic health diseases, but we all kind of know that when stress is really upon us and we're not handling it well, we can often feel it in our bodies. We can feel the tension, we can feel a headache, we can feel pain in our body. And so I think we all know there's a certain level of stress that creates an immediate and urgent bad, you know, occurrence in our health. So this slide kind of is an illustration of plaque rupture, where you might have chronic disease growing in your artery, but if something sudden were to happen, there's cytokines and endothelial reactions and things that happen within your bloodstream to release a sudden clot in an area that was relatively stable before. Just a fancy term for things in your blood. So I put up a definition for stress. I just looked in Wikipedia, which is a great resource. Stress can be described as pressure that exceeds one's perceived ability to cope. I think that's pretty good. So stress often has to do with your perception, doesn't it? So if you think you can handle what's going on, it's not stressful. Whereas if you perceive that you're not coping, that's very stressful. So another model talks about stress may not be a stressor if the person does not perceive the stressor as a threat, but as a positive or even as a challenge. If the person can use adequate coping skills, then stress may not actually be a result or develop because of the stressor. So, you know, that's a really interesting thought, that, you know, if you can get your mind around something that's giving you stress, you might actually be able to turn the same event around and have it not be a stressor for yourself. There's a slide saying, I'm a wife, a mother, a daughter, an executive, a cook, a housekeeper, a teacher, a chauffeur, and a soccer coach. That's only 19 pounds per woman. If only it could be so. So I put up a list of various kinds of stress management tools. And of course, you know, coming to the why is certainly one of those. Cognitive therapy, which is often done in counseling, conflict resolution, getting a hobby, meditation, mindfulness, deep breathing, prayer, artistic expression, spending time in nature, time management, relaxing music, quality time with pets or family, spas, yoga, physical exercise. All of these ways of managing stress have measured physiologic and immune benefits. They're not just mental, psychological, or blood pressure related. All these ways of managing stress are definitely known to reduce the bad effects of stress. So next we'll talk about healthy choices. This is a slide put out by the Department of Agriculture just talking about what is an average calorie count in the various ages of men and women to maintain your body weight. So it's very generalized. It's not necessarily true for everyone. But say, for example, you know, a woman over 50, if you're sedentary, really you only need about 1,600 calories a day to maintain your current weight, whereas in a man, about 2,000 calories a day. If you're active, 2,200 or 1,800 in a woman, and very active, 2,000 to 2,200. This is not a lot. One time I was at a, what's it called, Five Guys hamburger place up in Westwood, and I was sharing with friends, and I actually looked at the calorie count a large hamburger there, and I don't have anything against Five Guys, but the large hamburger was 1,400 calories. The large fries, and I love fries, 1,200 calories. So one meal like that is 2,600 calories. So that is not the kind of meal you can eat regularly and maintain your weight. So, you know, obviously we could really go into depth with foods. I'm not going to do that. I thought, you know, what we would just do is mention some things that you really ought to include. The calorie counts that I put up there, it's actually quite difficult to stay in range of that calorie count with junk food if you're focusing on getting good foods into your diet. And so really you ought to focus on what you should be eating, and there's hardly room for other stuff, things that are not really food, that come in a box and have names you can't pronounce. So if you're really focused on foods you should include, it would be leafy greens, you know, kale, broccoli, spinach, chard, mustard greens. Lettuce actually doesn't have too much in it. It's a lot of water. And the reason is those greens have a lot of antioxidants which fight cancer, fight heart disease, and vitamins that are naturally processed and absorbed probably better than, you know, a little horse pill. Olive oil has good fats which help you with your good cholesterol and help lower your bad cholesterol. Flaxseed is very popular now as a good fiber supplement and has other benefits such as the omega-3 fatty acids, which also are good for your cholesterol. Oatmeal has tremendous amounts of fiber, but it's just a recommendation for fiber. So however you like to take your fiber. It's usually in multigrains, in vegetables, or even in a fiber supplement. Tea is known to have antioxidant properties, and of course it has caffeine, which is not good for everyone. But in people trying to lose weight, it may actually be helpful because it is a stimulant. It does get you moving and keep your metabolism a little faster. It's thought that white tea may have more of some of those chemicals that are so-called good for you.
What about herb tea?
Sorry? Green herbal tea. Herbal teas don't have caffeine, which is good, but they do have these good antioxidant properties. So I'd say, you know, for many people that's even better.
Well, that's
Yes?
interesting. Boost metabolism.
Yes.
That would mean that you would burn off more calories.
Right.
So you could eat more food.
Right. For example, in Asian culture, it's kind of automatic that especially after a big heavy meal, that you would drink hot tea. You know, for one thing, warm liquids stimulate your stomach to empty, right? Because it's full, it wants to empty. And liquids empty easier than plain solids. And then the tea has kind of a fiber and that chemical effect in it that, again, causes things to move more quickly.
Well, in metabolism, you've got to use a certain amount given off as heat.
Mm-hmm.
So with this situation, then, you're going to be more warm?
Could be. Could be just the hot tea stimulates the warmth and burns more calories from just getting you warm. I don't know. That's an idea. I think we're burning a lot of calories tonight. Okay, so also other vegetables and fruits have plenty of antioxidants: broccoli, citrus fruits, tomato, watermelon. You know, pretty much any fruit and vegetable is going to have some benefits for you, and just certain ones have higher concentration of certain vitamins. Sodium is very well known to be a problem with high blood pressure. So especially if you have high blood pressure, you really want to keep your sodium intake under 1,500 milligrams if possible. And that's actually quite strict if you start reading labels, and just as I said with the restaurant food, if you read boxes, there's quite a lot of sodium in many things. Calcium, to prevent weak bones, you want 12 to 1,500 milligrams a day, whether it's in your diet or in supplement form. I usually tell my patients to try and supplement 500 milligrams and try to take through food the rest. And so if you can have dairy products, if you have 2 servings a day, generally that doesn't put your calorie count over the top, and then you can take a supplement of about 500 milligrams. You know, other ways, non-dairy would be dried fish, dark green vegetables, soy products. So this is a fun slide. I try to eat healthy. I never sprinkle salt on ice cream. I only eat decaffeinated pizza, and my beer is 100% fat-free. So I think we all like to try and get away with something like this. Around fitness, you know, we want to control our cardiac risk factors. As I said, you want to avoid or decrease smoking, lower high cholesterol, work on high blood pressure, manage diabetes, and keep waist circumference under 35 centimeters in women and under 40 centimeters in men. Sleep is critical. More and more studies are showing all the effects of what good sleep does and what poor sleep does. And it's correlated that if you have more than 8 hours sleep a night, you have better health, better sex life, less pain, lower risk of injury, better mood, better weight control, clearer thinking, better memory, and stronger immunity. And I think this is not something so easy to do, especially in this age of electronics and email and Facebook and kids calling and grandkids calling and friends calling and whatnot. So when I ask patients who actually get sleep what their habits are, I think by and large what I notice is that the people who do get a lot of sleep go to bed early. I think it's almost impossible to expect to go to bed late and have uninterrupted sleep on into the morning. You know, the sun rises, things start happening, the day gets going whether you want it to or not. So I think, like Franklin said, early to bed, early to rise makes a man healthy, wealthy, and wise. So if at all possible, shut down electronics, don't answer the phone, you know, get into a quiet habit an hour before bedtime, start reading or meditation or prayer, something quiet and calming so that you get yourself into a mood and get into a regular habit for early sleep. Exercise, obviously, is quite important as well. But exercise can be in any form. Obviously, it can be walking, dancing, gardening, doing a sport. There are many ways to get 30 to 90 minutes a day of exertion. The point of exercise, you know, one can be focusing on things such as strength, stamina, coordination. We also look at it to keep your heart healthy. So cardiovascular exercise may be different from exercise that's good for your strength or stamina or coordination. There are exercises specifically to prevent osteoporosis, things that are weight-bearing, you know, are good for keeping your bones strong. And then, of course, exercise can be targeted to if you're trying to lose weight. That type of exercise might be different than the types of exercise you would do for these other reasons. And that's something that, you know, you can talk to a fitness instructor at your gym or your doctor or a physical therapist or Google it. There's a lot of information. Many people make excuses for why they can't get fit or why they don't have time. And I was just reading on the internet and they said, you know, are you watching television at night? Who watches television at night? So, you know, what they say is if you're saying you don't have time and you watch TV at night, try to record your shows. Because just by cutting out commercials, you can reduce a 1-hour show into 40 minutes or less. And there you've created 20 minutes every night. So there goes that excuse. And if it's 2 hours, you've created 40 minutes for exercise. Another excuse is, I'm too tired. Well, that's not a good excuse because exercise actually gives you more energy. And if you're tired because you're trying to do it at the end of the day, then you might want to try exercise at the start of the day or early and, you know, really make it a priority. You know, I can't, I have kids or relatives or someone to care for. There's usually ways around that as well. If you've got kids to take care of, you can take them out to the park, go for a walk together, throw a frisbee together. And lastly, saying that exercise is boring is an excuse. But there are many forms of being active. We talked about smoking. On average, people try 10 times. So if someone's smoking and they say, oh, I give up trying to stop, I've just always been a smoker, that's not a good excuse. You know, you never know. The next time might be the time that they can actually quit. And the risk of heart attack and stroke is decreased immediately. Within 1 year after stopping smoking, their risk can be reduced by almost half. And by 5 years after smoking, the risk for heart attack and stroke can be similar to someone who's never smoked at all. So around family and friends, you know, obviously we love our families and friends usually, but occasionally they can be a stressor. So I put up a slide just to talk about that a little bit. I like Mother Teresa's quote, "What can you do to promote world peace? Go home and love your family." You know, people say all the time, you know, the difference you're going to make in the world starts with you. You know, treat others as you would want to be treated. And so when each of us have the desire to complain about someone else, I think it's good to go back to that idea of, you know, what am I doing to make the world a better place? And what better place to start than just in your own inner circle of your family or your friends, and looking at what are you doing to contribute to harmony and love within your circle. There's a nice definition by Shakespeare of friendship. It says, "A friend is one that knows you as you are, understands where you have been, accepts what you have become, and still gently allows you to grow." If relationships don't feel as if they're healthy or contributing to your good health, that can be very stressful. And so rather than complain about the other person, I think the things to do are, one, ask yourself, are you treating yourself the way you want other people to treat you? Because people treat you the way you accept it. You teach people how to treat you. So really changing that starts with your own treatment of yourself and deciding how you want to be treated. Are you filling yourself up first? Otherwise you have nothing to give to the myriad of people you're trying to help or take care of. Are you focusing on what you appreciate about the other person and not just your complaints? Briefly, just financial, I just threw it up there because obviously if your finances feel like a mess, then it stresses you out. So the questions to ask yourself are you making choices that will not add stress to your life? Do you have a healthy relationship with money or not? And do you have a reliable resource around money management? And then lastly, faith or spirituality. I think we all know that spirituality impacts our health. Everyone has a different definition of spirituality or faith or different opinion about it. So a general definition of spirituality I liked was just the deepest values and meanings by which people live. And if you have a disease in the body or some kind of discomfort, can you turn it around through the power of thinking and right thinking? In spiritual practice, usually you're trying to develop or cultivate your heart and mind or loving kindness. And one of the Hindu descriptions that I liked, and it's a little difficult to really understand what that is, it's just talking about how do you have a spiritual practice, and they describe that there are 4 methods. So, you know, there are religions and beliefs, but then what does it mean to practice spirituality? And I kind of like this Hindu description that there are practices in the way of knowledge. So some people might find spirituality by seeking knowledge. There's the way of devotion, meaning people might find their spirituality through being devoted and worship. The way of works, you know, the way of good deeds, doing kind deeds for others. And lastly, the way of contemplation and meditation, being introspective and focusing on the present, focusing on your own breath, your own thoughts, your own kindness. So kind of in summary, you know, in this day and age where we want better, faster, it says, I've always been a high achiever, always striving for bigger, faster, greater. And now suddenly I'm expected to settle for lower blood pressure and less cholesterol. Yeah. And then lastly, what fits your busy schedule better? Exercising 1 hour every day or being dead 24 hours a day? So that's all I have for tonight. So thank you very much, and I'll be around for some questions. Yeah, we did.
So for the cytokines are the levels, if measure the stress level, is that true? You said something
Not
else.
really. I mean, there are certain markers of inflammation. So there are things like sedimentation rate, C-reactive protein, but they're not perfect measures. And so I think some doctors are using them to help people decide whether to take aspirin or whether they try to convince someone to be really compliant with their medication, whereas some people say, oh, I'll take it, or maybe I won't take it. Maybe using some of those blood tests will help convince people to stick to what the doctor recommends. But they're not generally recommended to be measured.
Because I heard the inflammation, you think, is the basic cause of all disease. Is that true?
What is that?
Inflammation
Yes.
is a major cause of most diseases?
Sure. So that's why I put a lot of emphasis on stress management and the diet to look at things that reduce inflammation. And that's what antioxidants are all about, are foods that bind ions and free radicals that are kind of electronic things going around in our bloodstream and trigger our immune function into markers that lead to cancers and diseases. So yeah, there's more and more the theory that inflammation of variety of sorts is kind of one step in the trigger of things that we're genetically prone to. I think what really is the case is we're all born with a genetic map. So we're all born with certain diseases that might happen in our lifetime and they might not. But along the way, we may have a trigger or we may not. Sometimes a trigger is a virus. Sometimes a trigger is a stressful event. Sometimes a trigger is our weight. Sometimes a trigger is smoking. So there are a variety of triggers for genetic events, I think. And then sometimes it's just plain genetic. Yeah.
How would you approach a patient if you went to on some particular problem, and he's obviously obese, morbidly obese? Would you attempt to do something about that?
Well, sure, it's a good question. What do you do with someone who's morbidly obese? Well, absolutely. There are a lot of tools, a lot of education that needs to happen. It's not an easy problem because usually it's taken quite a while to get to the point of morbid obesity. It's not something that happens overnight or very rapidly. And so it's usually a multitude of habits that leads to that. And so the best success comes from a lot of education, a lot of support, often counseling or understanding why someone is using food other than for nutrition. Because, let's face it, after a point, food is, just for nutrition, you really require fairly little food. But when you're using food for other things, such as for being social, or out of boredom, or when you're emotional, that's typically where we get into having very serious issues.
Say what you would do if the patient came in for some other problem.
Oh, I see.
And you can obviously see that he's obese.
Yes.
Would you tell him that?
Well, you don't say, I'm sorry, sir, you're morbidly obese. You would just say, I'm very concerned about your weight. Has someone talked to you about that? And what have you been told? What's your understanding of, your condition regarding your weight? So I think, I would start with asking what they know about it. And someone might say, oh, yeah, I know, and I'm working on it with my doctor, and I'm going to Weight Watchers. And if they feel like they have a plan, But you can't ever really force someone to do something they're not ready to do. So it's a matter of asking in a respectful way and finding out what they know and what they're ready to tackle.
Are antioxidants and herbs like turmeric the same thing? I mean, if you want to support your immune system, what do you Google and make a list of that you need to eat a lot of?
That's a good question. That's the million-dollar question, isn't it? Well, I think there's no one answer. And, you know, there's a lot of people who study this in depth. There are a lot of people who want to make money from it. I think no one has the perfect answer just yet. I think there are we're going to find out someday. I think there's cultural eating. You know, there are reasons why cultures do things over thousands and thousands of years based on their climate, based on how that culture interacts, and based on the entire diet of that culture. So I think in America, where we extract little things from various cultures, I don't know that it's really going to turn out to be sensible, that it really makes sense. You know, ginger in one place may not necessarily go with ginger, garlic, turmeric, and all in the same diet. I don't know.
Garlic, turmeric,
yeah.
and when they're all together,
yeah, I'm a little
somewhere?
skeptical of whether that really makes sense. You know, tropical climates have very spicy foods for a reason. You know, it creates heat in the body, it creates sweat. You know, there may be many reasons why such a spicy, herb-filled diet is good in that climate. Not to say that, you know, people in a cold climate are healthier or less healthy than people. It's just an adaptive mechanism over time, I think. So extracting what's good for your health out of those cultural habits and chemical studies is very tricky. And then interpreting how that affects a general population, and that's assuming a general population has a known diet and a lifestyle, which we don't, you know, right? Everybody's diet varies. We eat at restaurants, we eat a variety of foods. So, you know, really, how do you answer the question of, is turmeric good for me? I guess, you know, the way to do it is to first start with the basics. You know, as we said, are you having a balanced diet from the 4 food groups? Are you taking care that you're getting vitamins and minerals in your food choices? Are you getting adequate protein? Well, in America, we're getting excessive protein generally, you know, and excessive carbohydrates usually. And then after that, yeah, then investigating, well, should I have spices in my diet? Well, one is, do they agree with you? So you might try it, and if it gives you upset stomach, that's probably not a good idea. But generally you tolerate it, and it feels good, and you feel better, you know, why not? I think culturally, garlic and ginger are very well known to be things to use to prevent colds and for illness and those kinds of things. I do it in my family. The moment someone's under the weather, there's chicken soup with garlic or chicken soup with ginger in it, and, you know, it feels good, it tastes good, you know, no harm.
I think a friend of mine have a blood pressure is too low.
Uh-huh.
Doesn't he should be out below like 50? He should
Oh.
cut down the medication or see a doctor right away.
Yeah, blood pressure where the bottom number is 50 is too low. Yeah, the bottom number really ought to be at least 60 or higher.
Sometimes they over-medicate.
Yes, it can be
Same
over-medicated.
thing about diabetes.
Yes.
Like colon and those are very big.
Yes, yes. So yeah.
A1C, I think you decided should be below 5 or 6.
Yes.
Up there is.
Yeah, quite high, right. Okay, well, I'll stick around, and if anyone has individual questions, you can come up to me. Thanks.